A medical alert this evening, an alarming rise in the number of patients rushed to emergency rooms in this country after taking stimulant drugs. And it's not just children, it's parents taking their children's medicine as well. Here's ABC's chief medical editor, Dr. Richard Besser tonight.
Emergency room doctors are seeing more and more patients who've made themselves sick with stimulant drugs like Adderall.
10 years ago, we really didn't see this problem. It didn't really exist.
Stimulant drugs like Ritalin and Adderall make it easier for people with attention deficit disorder to focus. But the 300% rise in ER visits that this week's study is talking about, from 5,600 in 2005 to 23,000 in 2011, are young adults between 18 and 34, students, professionals, even moms. They don't take the drugs because they need to. They take them because they want to.
Students, teachers, lawyers, everybody may be using them, especially if they have a project that needs to be done and they need to have some kind of way of staying awake.
Hi, sweetie.
Young moms like Betsy DeGree, who took her own child's ADHD meds to be able to do it all.
I was able to get all the stuff done around the house. I was able to, cook the dinner and have everything perfect.
She ended up having to shake an addiction. Jody Gamble, a nurse, took 10 pills one day and went to the ER.
I knew I was probably having a heart attack on Adderall.
They come in with elevated heart rates, high blood pressure, even seizures.
In most severe cases, people can have problems with their heart and actually seizures from them.
Seizures?
Yes.
So for moms just trying to cope, to college kids taking them as a study drug, who think these drugs are somehow safe, a warning.
When used inappropriately, they can become very, very toxic and very serious. So I'm definitely worried about it, yes.
And Dr. Besser's with us now. That number is staggering. Hospital visits up by 300%. But where are parents and kids getting their hands on the drug if it's supposed to be prescribed by doctors?
Right. I mean, as we saw, some parents are using their children's prescriptions, but on campuses, the kids are getting it from their friends, their peers. There's a black market.
Which is why they're sounding the alarm in these ERs across the country now.
Yeah, I mean, the idea is you can't treat these drugs casually. Even though they're used safely in children under doctor's supervision, they can be very dangerous when you use them on your own.